At Cook Children's, we've made a promise to improve the lives of every child in our region. Our promise means bringing innovative breakthroughs and family-centered care to all of our patients. We often start with the littlest babies in our Newborn Intensive Care Unit. These babies need specialized care in a warm and inviting place where the whole family can heal together. It gives them a new beginning, the chance to begin their experience as a family sooner.
It's the unit of miracles. I don't know any other way to say it. We have interventions and specialists and procedures that we can do to make the impossible possible sometimes.
My favorite part about working in the Cook Children's NICU is really helping to take care of not just the babies, but also the families that come to us. Whenever a child or an infant's admitted to the hospital, the whole family's admitted to the hospital.
When I take care of a patient, I take care of them as if they were my son or daughter.
I love children. I love newborns, but I also love critical care medicine.
Aside from a baby still being in the womb with the mom, and aside from being at home healthy and strong and thriving, that it's probably the next best place for them. When we are setting a patient up to be discharged and go home, we want to set them up for success.
We want their time in the Neonatal Intensive Care Unit to be an easy transition and become prepared for that baby to come home.
We want to do all that we can to really help them feel comfortable and in control, to know what to do through what's predictable, in their baby's day. But then also we want to help them be ready for what isn't expected so that they can still be successful at home.
Our staff toured many NICUs around the country. We've read every article on single room design to make sure that all those best practices and other people's experiences were incorporated into not only the design of the unit, but the workflow of the unit and the way the care is provided. The administration at Cook Children's has been very forward-thinking in saying these are things we need to do for our NICU to make it the best in the country. And we think we do have one of the best NICUs in the country.
Everyone involved in the care of our patients, they have a certain affinity for babies and children in general. They have a certain calling to be in that population, and I really feel like it makes a difference.
Cook Children's is an amazing place to be. It is the only place I ever wanted to be as a nurse, and I'm very privileged to be an employee here.
I would encourage any parent who knows their child is going to need a NICU to support them, or a parent who's in an emergency situation like I was, to really consider Cook Children's. The physicians are fantastic. The nurses are superior beyond imagination. They are my heroes. Everything about Cook Children's made me feel like something good was going to happen, and it did.
The Cook Children's Neonatal Intensive Care Unit, a place of endless possibilities for new beginnings.